Hello guys, welcome to my study room. Today I will discuss about malaria. First we know about introduction to malaria. What is malaria? A life-threatening disease caused by parasites of the Plasmodium genus, transmitted through the bite of infected Anopheles mosquitoes, most commonly found in tropical and subtropical regions, particularly in Africa, Asia, and Latin America. Then, global impact of malaria, statistics, around 2,041 million cases of malaria worldwide, causes over 6 million deaths annually, predominantly in sub-Saharan Africa. Children under 5 years and pregnant women are most vulnerable. Geographical spread, endemic in over 87 countries. Africa bears 94% of the malaria burden. Then, causes of malaria, Plasmodium parasites, 4 main species that infect humans. 1. Plasmodium falciparum, most deadly and widespread. 2. Plasmodium vivax, causes recurring infections. 3. Plasmodium ovale, and 4. Plasmodium malariae, less common, transmitted through bites of infected Anopheles mosquitoes, which are active during the evening and night. Then, malaria transmission cycle, transmission process. 1. Mosquito bites an infected person and ingests parasites. 2. Parasites develop inside the mosquito. 3. Infected mosquito bites another person, transmitting the parasites. 4. Parasites travel to the liver, multiply, and then infect red blood cells. Then, symptoms of malaria, early symptoms, fever, chills, and sweating, often in cycles. Headache, nausea, vomiting, and muscle pain. Severe symptoms, anemia due to destruction of red blood cells, organ failure, kidneys, liver, and respiratory issues. If untreated, it can lead to cerebral malaria and death. Then, diagnosis of malaria, common methods, microscopic diagnosis, blood smears examined under a microscope to detect parasites, rapid diagnostic tests, RDTs antigen tests that detect malaria proteins in the blood. Importance of early detection. Early diagnosis is critical to prevent complications and reduce mortality rates. Then, treatment of malaria, first-line treatments, artemisinin-based combination therapy, ACT's most effective treatment for Plasmodium falciparum malaria, chloroquine, used for Plasmodium vivax and other non-resistant strains. Challenges, drug resistance is increasing, especially with P. falciparum, ongoing research to develop new anti-malarial drugs. Then, nutrition in malaria, serve a well-balanced diet rich in protein, vitamin, iron, and carbohydrate to promote energy. Serve food in bits but at frequent intervals. Serve food attractively. Encourage patient to brush her teeth to boost appetite. Remove bedpans and all unattractive articles out of patient's sight. Encourage patient to drink more fluids to prevent dehydration due to profuse sweating and vomiting. Then, personal hygiene, encourage patient to bath at least twice daily. Encourage patient to brush her teeth at least twice daily. Encourage patient to wash hands before eating and after visiting the toilet. Then, elimination, serve bedpans and urinals to help patient pass urine or feces. Apply warm compress to patient lower abdomen to help him pass urine or open nearby taps to have psychological influence on her to pass urine. Give enema to enable patient pass feces. Then, prevention of malaria, personal protective measures, use of insecticide-treated bed nets, wearing long-sleeved clothing and using mosquito repellents, indoor residual spraying, IRS, with insecticides, preventive medications, prophylactic anti-malarial drugs for travelers to malaria-endemic regions, ongoing development of malaria vaccines. Then, malaria control and elimination efforts, global strategies, distribution of insecticide-treated nets and increased access to rapid diagnostic testing and treatment, challenges, poverty, lack of healthcare infrastructure, and increasing drug and insecticide resistance. Climate change may expand the regions where malaria is transmitted. Then, recent advances in research, vaccine development, RTS-AS01, Mosquirix, first vaccine to show partial protection against malaria in children, ongoing clinical trials for next-generation vaccines, gene editing and genetic modification, research into modifying mosquito populations to reduce transmission. Use of CRISPR technology to make mosquitoes resistant to Plasmodium parasites. Then, conclusion, malaria remains a major public health threat, particularly in developing countries. Continued efforts in prevention, treatment, and research are essential to combat the disease. Global collaboration is key to achieving malaria elimination. Thank you for watching my presentation. Please subscribe my channel. If you want to know about any topic, please comment me.